And welcome to day 3 of ChristianaCare's Men's Health Week. Today is all about sports and lifestyle medicine. So we've brought in Dr. Elizabeth Barchie. She's a sports medicine and dance medicine specialist here at ChristianaCare and is coming to us live from ChristianaCare's Concord Health Center in Chadds Ford, Pennsylvania. Dr. Barchie, thank you so much for joining us today. Please take a minute to introduce yourself.
Thank you so much, and thank you so much for having me. I'm Dr. Elizabeth Barchie. I'm one of the sports and lifestyle medicine doctors here at Christiana. I have 2 office locations, one which is gorgeous on the beach. Unfortunately, no, it's just on Concord Pike, up just over the Pennsylvania border in Chadds Ford, and the other is down at the main campus in Newark at the HCCC location.
Fantastic. So let's kind of define sports medicine. So many people hear sports medicine, they're thinking athletes and sports teams, but it's so much more than that.
Oh yeah. So we really, in sports and lifestyle medicine, we really take care of people who are active, just anyone who is active, either if you are a young athlete, an adolescent athlete, college, retired, if you're just a weekend warrior, or someone who likes to go to the gym and work out. Or even someone who wants to be active. Say you used to be an athlete in high school and you want to get back into sports, but you want to make sure that you do it in a healthy way. That's really what we do and who we take care of. So there's a wide breadth of patients that we will see in the office, and all of them are, they're wonderful to work with because we have so many different goals that we help them achieve and accomplish.
So let's dive a little bit more into age. Those weekend warriors who may be in their 40s, 50s, 60s still can easily come and seek your help.
Oh, yes, absolutely. In fact, weekend warriors are our bread and butter in sports medicine. I know everyone thinks about, the football players that they see on TV, but really who we see the most are the weekend warriors. Those people in their 20s, 30s, 40s, 50s, 60s, and beyond. There are a number of different considerations that we have based on age. There's the adolescent athlete, the young adult athlete, but then we start getting into the masters athletes who are more into the 60s, 70s, 80s. And so age plays a factor in how we approach an injury or how we approach the goals, the fitness goals of the patient before us. But really it's not limiting in that sense of we don't limit who we see based on age. And so really anything's possible, but for those weekend warriors, you guys are our bread and butter and we love working with you.
And what is unique about ChristianaCare's sports medicine department? Obviously, there are a lot of options for people out there in terms of seeking sports medicine professionals, but what makes ChristianaCare stand out?
ChristianaCare is a really great division. The sports and lifestyle medicine division is really great in the sense that we work together as a team. So when you come to see us, you'll first see the doctor, so either me or one of my colleagues. And then you may also, depending on the day, see and work with one of our certified athletic trainers. The purpose of this is so that, we see you, we talk about your injury or we talk about your fitness goals, we decide on a plan, and then our athletic trainer will help us implement that plan. So whether that's working through your fitness goals and creating a step-by-step plan on how to build that and get there, or to start you off on some home exercises so that you can get yourself started and start working on your goals right away. Next, we'll have you work with a physical therapist, usually not in the same day, hence why it's helpful to have an athletic trainer who can get you started on a program. Working with a physical therapist is really important because they're like your long-term coach. So they're going to be working with you, helping release some of the tissues that need to be released, looking at your whole body and the way you move and helping you to rebalance the muscles and so that the mechanics of how you're moving and how you're doing each movement are optimized as much as possible. We also work with sports nutritionists who can help make sure that your diet is balanced and really working for you. and making sure that you get enough protein, enough healthy fats, talking about the different types of carbs, because there's a lot of information out there on the internet and on TV about these fad diets. And sometimes it's really helpful just to sit down and talk with a nutritionist. It's also helpful too, because you can get your questions answered about, do I need creatine? Do I need this supplement or that supplement? What about magnesium? And so working with a nutritionist helps you take a look at the diet as a whole and really make sure that you're getting all the nutrients that you need in the most healthy way possible, which is usually through the foods that you're eating rather than taking a bunch of pills. But if you need a supplement just to help make sure that you're getting enough, they can make recommendations for that too. And then finally, we also have patients work with a sports psychologist sometimes. It is important to always recognize the fact that injuries can really, really impact you in a number of ways. So take someone who plays soccer on the weekends with an intramural group. What if they sustain a ACL rupture? So that's a long road of recovery, no matter which you choose. If you're going to go with surgery, if you're going to go the non-operative route and just rehab, either way, you're looking at months and months and months of intensive rehab. That's really tough on anybody. And so, and then once we do that, then we also have to get back into the sport. And a lot of times there can be mental blocks about getting back in. I've had patients, I've had dancers who they're cleared to go back, but they just can't. They know they can, but they can't. And it's a mental block. And so it's really helpful to be able to have someone supporting you in your mental health throughout this whole process, because it can help reveal things, uncover mental blocks and help you work past them. It can help support you, through the loss of identity, through the difficulty and intensity of rehabbing major injuries. And so, to get back to your question, what makes ChristianaCare sports medicine unique? It's the fact that we have all of these team members for one single patient. And we all work together. We have open communication. We're all on the same page. Everything's in the same system. So, if a patient is coming in for a follow-up, not only can I just walk upstairs most of the time and speak with the physical therapist, or just pop on the phone and speak with the physical therapist about what they're seeing, but I also have their notes in front of me so I can keep track. Physical therapists, if they have any concerns when they're working with the patient, can just reach out to me very, very easily. And then, same thing with the athletic trainers, same thing with the nutritionists and the sports psychologists. We all work together. And so we make sure it's a seamless treatment process for the patient overall.
That team care is so important. And I think another thing that's amazing about ChristianaCare as a whole is how we can connect across all specialties as well. So talk a little bit about how your team is able to connect with primary care or other doctors who your patients may already be seeing.
Yeah, we actually have a few avenues for connecting with our primary care doctors. I always encourage primary care doctors just to reach out to me. We use a system where they can just chat me. And so it pops up on my screen and then I can address their question very quickly. And usually it's a pretty straightforward question of, hey, what kind of x-rays would you get? Or do you think this person needs x-rays? Should they be seen? And, we can talk about it quickly and then make a decision for the patient without having to have extra visits and, extra time for the patient. So I do encourage primary care doctors, whenever I meet them and talk with them, to always reach out and we get back to them very, very quickly. We also have formal pathways where they can submit clinical questions and we usually get back within 24 hours or so. And so we can help guide our primary care doctors with the initial phases of workups and making sure the patient can get in to be seen right away. A lot of times what happens is in other places, a patient might get a referral, but they don't know where to go. They don't know the number to call, or they call the number and they're told, oh, well, it'll be a 6-month wait. And at that point, if it's a fracture, or if it's a tendinopathy, that'll be healed by then, or you'll have a whole nother set of issues because of that initial injury. And so, we have a couple of different pathways to working with primary care doctors to ensure a seamless and expedited care for the patient.
That's great. If someone is watching at home thinking, oh, well, my elbow has been bothering me, or I tweaked my knee a few years ago, what constitutes things that they would see you for versus things that they maybe wouldn't see you for?
Yeah, so we see almost everything. So a lot of overuse type injuries. Elbow is one of the famous ones because when it hurts, it really hurts. And so we'll see a lot of tendinitis, chronic tendinitis, arthritis, bursitis. We'll do also strains and sprains. If you twist your ankle, stepping off a step wrong, if you, break a finger, break your toe, stubbing it into the bedpost. A great fear of mine actually is breaking my toe that way. And so we can take care of that. One thing that we don't do is surgery, but we can help, if we're taking care of a patient and we work up, the acute injury, or we are taking care of them for a long time and it becomes apparent that surgery is the next step in that pathway. We also have a lot of surgical colleagues that we work closely with, so we can get our patients in to be seen quickly, and also with people that we trust who are high-level surgeons and who are fairly conservative in their care. Because sometimes it's not always the same across the board. So it's helpful to have that connection to make sure that you can, one, be seen quickly, and two, be seen by someone who's trusted.
That's great. So much important information. So before I let you go, kind of sum it up. What is the most important thing that you want viewers to understand about sports medicine?
Yeah, so sports medicine is all about being active. So when you come to see us, get ready to move, because that is our main goal. If I can get you active and moving as part of a healthy lifestyle, that is a victory for me. So not everyone wants to be as active as they should be, but we try to encourage you to work through those barriers. We discuss those barriers and see where we can change things around to help you live a more healthy and active lifestyle. So that's the most important thing, is that coming to see us, we are going to get you back to your activities, to your sports, to the things that you love to do. And that is our goal for you guys, for everyone out there.
And if someone at home is saying, yes, that is me, how can they find you?
If you just Google ChristianaCare sports medicine or sports and lifestyle medicine, we come up on the homepage of Google. I think we're the first click. And if not, we come up with there's the map and the call this number. You can call either 302-320-9440. Or you can pop online, the ChristianaCare website, you can find us there. And if you just Google ChristianaCare Sports and Lifestyle Medicine, you'll get to our homepage, and the number is there as well.
And if you are watching us live on Facebook, check those comments below. All of the links you need, all of the numbers you need. Some more information about Dr. Barchie is all there right in the comments. Well, Dr. Barchie, thank you so much for your time, and have a great afternoon.
Absolutely. Thank you so much for having me. It's been great.